President Trump says he will take a COVID-19 test before the debate Thursday. The state health department says more Tennesseans are doing the same lately, with 13,000 new tests administered in the last 24 hours.
But the type of test that you could get seems to be up in the air still. News Channel 5's Chris Davis live at the Nissan Stadium Testing Center. And Chris, what did you learn about this?
Well, Rory, you may remember when the COVID outbreak first started earlier this year, the only test you could get involved a long Q-tip going way up in your nose. For the last few months, there's been a milder option available, but which one you receive depends on where you get tested.
Some people are still coming and still a bit fearful.
In many ways, COVID tests are a game of inches.
It's not the most comfortable process, but it's not a painful process.
But each additional inch can feel like a lot more when it involves your nose.
We leave it up to the clinicians to select whether or not they want to do a nasal or a nasopharyngeal test.
The nasal test just swabs both of your nostrils. The nasopharyngeal test, jokingly referred to as the brain swab, goes a lot deeper. Both are accepted by the CDC. At Vanderbilt University hospitals and clinics, Dr. Jonathan Schmidt says most of the clinicians choose to go deeper because it's more thorough.
All things being equal, it's nice to say try to collect as rigorously and vigorously as possible.
But it's not always equal when it comes to someone's pain tolerance or fear. So a patient can request a milder nasal test.
We have the longer swabs that permit folks to do either sort of testing technique that they deem appropriate for a given patient.
The drive-up testing centers around Nashville also use the longer stem swabs, but the testers are instructed to only swab around the inside of your nostrils.
Just a simple nasal swab in both nostrils and not the nasopharyngeal.
Dr. Julie Gray at MEHARRY Medical College admits those swabs can look intimidating, but it shouldn't feel that way.
The swab itself does look long, but that entire length of the swab of what you saw is not going all into your nasal cavity.
Now, of course, over the last few days in both Nashville and Tennessee, we have seen an increase in the case count, which has made a real emphasis on testing moving forward. Both MEHARRY and Vanderbilt say no matter what, they are prepared if there is an increase in demand for the tests they need to give. Live downtown, Chris Davis, News Channel 5.